Welcome to another edition of the Inspired Stories podcast, where leaders share their experiences so we can learn from their successes and be inspired by how they've overcome adversity. My name is Anthony Codispoti, and today's guest is Dr. Payam Tehrani, CEO of SNF Wound Care, based in Beverly Hills, California. They provide expert bedside surgical wound and skin care for skilled nursing facilities across the country. They focus on reducing hospital readmissions by offering services like G-tube replacements, wound vacuum applications, and in-service training at no cost to the facilities. Dr. Tehrani has been leading SNF Wound Care since 2017 and is a board-certified wound care specialist with training in internal medicine and hyperbaric oxygen therapy. Before starting the company, he served as an attending physician at Long Beach Memorial Medical Center, where he worked closely with the renowned Dr. Michael Strauss to develop specialized wound care programs. Under his leadership, SNF Wound Care has grown steadily, earning reputation for outstanding patient support and innovative treatment strategies. Now, before we get into all that good stuff, today's episode is brought to you by my company, Add Back Benefits Agency, where we offer very specific and unique employee benefits that are both great for your team and fiscally optimized for your bottom line. One recent client was able to add over $900 per employee per year in extra cash flow by implementing one of our innovative programs. Results vary for each company, and some organizations may not be eligible. To find out if your company qualifies, contact us today at addbackbenefitsagency.com. Now back to our guest today, the CEO of SNF Wound Care, Dr. Payam Tehrani. I appreciate you making the time to share your story today.
Thank you, Anthony. I appreciate for having me.
Okay, so how did this all begin? How did you get into the field of specifically wound care?
So I used to be a hospitalist, which is an internal medicine physician at a facility at Long Beach Memorial Hospital. And, as a hospitalist, you take in a lot of patients. When they go through the ER, they have, some issues, the hip fracture, whatnot. They call you and they say, hey, patient's coming in with a hip fracture. And, we have an orthopedic surgeon on call who's taking, the patient to the OR, but we want you to do their medical management. And, so I would be the medical management for these patients. And they would always use a specific, surgeon, Dr. Michael Strauss, that, was extremely helpful. And I had a close relationship with him. And what would happen is that, he would do the surgery and then I would do their medical management. And then after when all was said and done, they would end up back at his clinic just to make sure the patient's wound was healing. So Dr. Michael Strauss would do their surgery, also the follow-up wound care on these patients. And then after some time, I was told like, hey, come to my clinic and, see some of these patients for, basic wound care who have these wounds. Some of them are healing great, some of them are not healing so great. So I went over to his clinic one day and he kind of taught me how to do wound care. Zero expectations, took me in, like a son, and pretty much showed me how to do wound care for all sorts of wounds, not just surgical wounds, but, pressure wounds, diabetic foot ulcers, venous ulcers, all sorts of stuff. So I kind of learned it. And that's kind of how I got into the, wound care aspect of life.
So for the layperson, the outsider, somebody not in the medical profession, wound care to me is, I don't know, you wash it with soap and water, you put a bandage on it, you wrap it up. Clearly, I see you sort of smirking. There's a lot more to it. Like, educate us. Why is this sort of a specific area of medical care?
So there's a lot more to it, depending on the amount that it drains, the etiology of what caused it. You want to make sure the cause is not there anymore. The amount of drainage. There's multiple different, ointments that we can apply to these. Certain ones help it, clean it up. Certain ones are for moisture. So it's a little bit more than that. But yeah, we see a lot of improvement with one cream versus another. There's so many different ways you can treat these wounds. And a lot of it's trial and error.
Are there tests that you do on the wound to see, I don't know, like what the bacterial culture is?
So there's a lot of marketing out there for that, like use this test, run this test. But our patient population, because they're in nursing homes, a lot of them are incontinent. And if they're, incontinent and, they're going, you swab these wounds, you're going to grow multiple different bacteria just because they're soiled and whatnot, and then
Mhm.
you don't know if this bacteria is really causing an infection or if it's a contaminant. So we really don't swab them as often because we're getting a lot of contaminants, and then we have to treat the contaminant, and then we're exposing these patients to a lot of antibiotics. So we have more of a clinical judgment. Do we think the wound is infected? If we do, then we'll probably get a deep culture and go from there. But just swabbing them, we will grow a lot of resistant bacteria that aren't necessarily doing anything. They're just hanging out on the wound, and they just need to be, flushed off as opposed to taking antibiotics.
Gotcha. Okay. So we have Neosporin in our house. Is that something we should be using?
I mean, Neosporin's great. It works. Even in some of these nursing homes, we use Neosporin.
Okay.
But does it, there's a lot of other things that are a lot better.
But there's no downside to me using it. Sometimes I see articles online that say, "Oh, it's worse for the wound. It slows down the healing." What?
I mean, I would put if you're home and you have a wound, I would put Neosporin on it for a few days, and if you see it's getting better, hey, continue. If you see it's getting macerated and getting worse, maybe time to reach out to somebody and be like, hey, applying it, not getting better, and go from there. But yeah, it would be a good starting point.
Okay. So, doctor, I understand that you've introduced bedside surgical wound care in skilled nursing facilities specifically. Is this a rather unusual approach?
So I think, a lot of these nursing homes have these elderly patients. A lot of these elderly patients, on top of their multiple comorbidities, they have, a long list of comorbidities. Another one they have is the skin and wound issues on top of it. As you get older, you become more, immobile, more bed bound. And, you bump your leg here, you lay in bed for longer, you get all sorts of skin and wound issues. And, certain nursing homes that kind of are in very rural areas, they are sending these patients out to getting an ambulance because these patients are immobile on a gurney, bedbound, and they're transferring them out to a wound clinic, and it's very costly. They have to pay for the ambulance, the whole transportation ride, and who's paying for this, right? So a lot of these, physicians, we send out the physician to the nursing home, and then on average, I would say there's about a 15% wound rate. So if you have a facility that has about 100 patients, about 15 patients will have a wound that we would go out there and we would see pretty much anyone with any sort of skin or wound issue. This way you're avoiding that transportation cost. It's easier for the patient. The patient doesn't have to be transferred out and all that.
So you said, let's cut out that expensive transportation process, which is probably also relatively unsettling to the patient, and let's bring the care right to where the patients are, right in the nursing home facility.
Right to where the patients are, as opposed to transferring patients out. Imagine 15 ambulances a week trying to transfer patients to wound clinics.
Okay. So, so you learned from Dr. Michael Strauss. That kind of got you started in this. And then what was sort of the next leap into actually starting your own practice?
So started with him, learned it, and then as a hospitalist, which is just basic internal medicine, following up patients at the hospital, I would also go to the nursing homes and just see them for primary care management and make sure everything's okay, their blood sugars and whatnot. And I remember, one of the the heads of the nursing home says, "Hey, we're using a certain company. We're not happy with them. Your patients that you have that are under you also have wounds, and we heard that you're familiar with wound care. Do you want to see a few of these patients yourself so we don't have to give them to this other company that we're using?" I was like, sure, I'll see my own patients myself and I'll take care of it. So the few patients that I did have in that facility, I saw myself and I did a great job, and I became friends with, the nursing home people. And then they're like, "Hey, do you want a couple more patients?" And I thought about it and said, sure, I'll take a couple more, patients that have wound care. But the problem was it was a weekly thing. I'd have to go there weekly to see these patients. So I ended up going there weekly to see these residents, and they did well. And then the nursing home's like, "Hey, we plan on cutting our contract with this company and going with another company. But if you want the contract, we'd be happy to give it to you." So I took one facility. That was my first one. That was in Long Beach. 2017. And that was the first one. And then this company had multiple nursing homes, 7 or 8. And then they kind of put me into the different ones as well. They said, hey, come to this one, come to this one, come to this one. And at that time, my full-time job was to work in the hospital. It wasn't really these nursing home stuff. So once these nursing homes became, 7, 8, 9 nursing homes, I'm like, do I leave my full-time job at the hospital and do, full-time nursing home? So what I was doing was I was like, wake up at 3 in the morning, go to the hospital, see my 25 patients at the hospital, leave at like 8 a.m., from 3 to 5, 3 to 7, 8, see those patients, take all the calls that come in for them, and then also go to these nursing homes in the, late
It's a
morning.
lot.
And yeah, so it was a lot. And I was doing that for about a good year. And until these nursing homes became excessive and I couldn't do the hospital work anymore. I'm like, okay, I'm going to just have my own business doing nursing home wound care. So I just ended up, cutting the hospital work off, going to these nursing homes and seeing these wound patients. And then I just got called for more and more and more nursing homes. And then some of these nursing home, like the heads would leave and go to another city, another state. They would call me and say, hey, can you come to Phoenix? Can you come here? I mean, now I'm in Alaska, Florida, Maine, all over the place. And then, it just keeps growing. As long as you offer good service, you're honest, and you do what's right. If they see you're doing what's right and you're not just there billing and doing it for the money, they honestly bring you in. And I think that's kind of where I grew, was because we don't always do what's profitable. We do what's right.
Payam, what was it that you were doing that was so different / better than the companies that they were already using, to where they approached you? You're not knocking on their doors. You're not marketing. Say, hey, doctor, we love what you're doing. What were you doing that was so much better?
So initially I was knocking on doors, but I was picking up
Okay.
my phone on them. How many times do you have direct access to a physician who's going to pick up his phone at 2 in the morning and get the job done, get your notes for you, show up at 2 in the morning for something urgent? Other people don't pick up their phone, or when you're dealing with them, they don't pick up their phone. So I was actually picking up the phone, getting all the work done, showing up when they needed me, getting them out of problems, doing the documentation correctly, getting it done promptly, all these things. And not a lot of other people are doing it.
A lot of facilities cite cost as a barrier to this kind of advanced wound care that you provide. But if I'm understanding this correctly, you offer your specialized services at no direct expense to them?
Correct. So what we do is these patients, so these nursing homes are, it's a business. They take in these patients and they, build their health plan, right? So when you go there, they build whatever health plan the patient has for the stay and for the rehab and for everything. So we also build the patient's health plan as well. So when we see the patient on a visit for, whatever issue they have, we don't bill the facility, we build the patient's health plan. So it's free for the facility, more or less, because we're not billing the facility. And then we also see all patients. We don't discriminate and say, oh, this one has, their insurance isn't very good, we're not going to see them. No, we just, everybody's got to be seen. Whoever has an issue has to be seen. I remember when we first came from, my parents came from Iran. They didn't have the best insurance. They probably had no insurance. And I remember one doctor saying, oh, I can't see them because they don't have an insurance. And that's the last thing I want to do, say, no, I'm not giving care because your insurance isn't the best. So that's, something we don't do, is we just see everybody with the same standard. And, if we get paid, great. If we don't get paid, we just write it off.
Oh, wow. I'm going to guess that most of the patients have some kind of insurance, because if you're in nursing homes, at least they've got Medicare, right?
Correct. Most of the patients almost all have some insurance, but they don't all have decent insurance. Some of them have very bad insurance. Some of them, their insurance doesn't pay us. They make an excuse not to pay us. I would say about 70% we get paid. The other 30% we just eat it.
Is that typical in medical field?
Based on what I'm hearing, well, I mean, some providers are just like, no, we're only going to see patients that insurances that actually pay us, and they want, a pre-authorization that they are going to get paid. But I mean, by the time we sit there and wait for pre-authorization, we could have just saw the patient and got it over with.
So it's interesting, your background, your parents coming from Iran and saying, oh, hey, we can't see those folks. Their insurance isn't very good.
Yeah.
Like, that's stuck with you. That's imprinted on you.
Yeah.
That's not a situation that you want to put somebody else in.
Especially when you're elderly, a lot of these patients in nursing homes are confused, they're demented, and to say no to one of these patients and can't see them, can't care for them, especially when they can't even make decisions. Their health plan is telling you what to do. So it's the last position I would want to be in if I'm in that case.
We need more doctors like you.
So.
So let's talk about treating tough wounds like venous stasis ulcers and pressure ulcers. Why are these challenging, and how do you deal with them?
So pressure is very challenging. Pressure wounds develop because the patient is immobile. Usually these are, as you get older, you become less mobile, and you're not going to become more mobile with time. You're just going to become more immobile with time. Or if you're, a paraplegic, you're immobile and it's not going to change. And when you're immobile, you're prone to pressure injury, pressure wounds, bed sores. So the problem is these wounds are developing because you're immobile, and you're not going to get better. You're likely only going to get worse. So it's very hard to treat these patients if the underlying problem of immobility is not, it doesn't get better. So pressure wounds are very hard to treat because the patient's immobile, and their weight continues to put pressure on the site, for example, the heel. And and when you have that pressure on the heel, the blood supply or whatever tissue is underneath that heel is compressed because of the weight of the foot, and then there's poor blood supply. So it's just not going to heal regardless of how much we care for these wounds, because of that, their immobility remains. But if you can remove the inciting agent, it gets better. But when we can't get these patients, more mobile, they can't turn and reposition them, we're supposed to reposition these patients every 2 hours. Almost all nursing homes do a great job at doing this, but they go for 4 hours without being repositioned. It causes a problem. A lot of these patients are non-compliant. They don't want to wake up at 3 in the morning to be turned. It's hard to wake them up 3 in the morning, 5 in the morning, turn them. They want to sleep. But then on the other hand, their wounds are getting worse, and because they're paraplegic or they're not feeling the wound either, so they're like, well, don't wake me up, and then their wound gets worse.
Doctor, I think you've got email or an instant messenger kind of open in the background that's dinging it. But that's something that you're able to close.
Yeah.
But while you're looking at that, I'd like to understand what hyperbaric oxygen therapy is. Can you talk about that?
So now, when I was in the hospital, we did some hyperbaric oxygen therapy. This was more for acute stuff when the patient had like a surgical flap that failed. There's not enough blood flow to it. We would have them go under hyperbaric chamber. I think it was like close to 30 different sessions of hyperbaric. But we don't do it for the nursing home population. The nursing home population's wounds are chronic. And these chronic, I'm sorry, I don't know how to turn off the sound for that thing. So then the emails that come in are, yeah. The patients at nursing homes, their wounds are chronic, and hyperbaric is more for more acute stuff, for flap issues that are not getting enough blood flow. So we want to increase the oxygen in the blood to get it to these acute stuff. But for these chronic wounds, these patients have had it for 4 years, 10 years, 20 years. So giving them hyperbaric is not necessarily gonna help them much. We've tried it. We didn't see much improvement with the chronic wounds. And then also, it's very hard to put these patients in a chamber, especially if they're confused. Put them in a chamber, they're probably like, why am I in a chamber? So it's hard to put this population in a chamber.
And so what happens once somebody's in the chamber?
They put them in a hyperbaric chamber. It's like a tube. And they're in there for 90 minutes, and then they, increase the oxygen to that chamber. And as you inhale higher levels of oxygen, it goes into your lungs, it goes into your circulation system. And they think with hyperbaric oxygen, these wounds are supposed to be healing better. I've seen it for acute wounds. I've seen acute wounds do better with it. You can see it's more red, more pink, the acute wound. But does it always work? No. Some insurances cover it. Some insurances don't cover it. But it doesn't always work, and sometimes it does work. But heck, if it's your last resort, you might as well try it and see if you get better.
Yeah. So it doesn't work so well in the nursing home environment, to where you're dealing with a lot more of these chronic wounds.
Correct.
given what I've already heard from you, hey, we want to take care of the patients. We're not going to argue that they don't have coverage. I have to imagine that you've probably got a collection of stories, like specific stories of like success. You go in with a patient and here's a problem that they had, and here's what you guys did to kind of help them recover. And I'm wondering if maybe you can pull one from your memory banks that would be fun to share.
Yeah, we've had a few of these where there was one gentleman. Um, he he was very immobile, fairly young guy, fairly immobile, and we were hopeful that he's going to be back up and walk. I think it was a motorcycle accident. We were hopeful that he's going to get up and walking again, but he had a couple pressure wounds and fairly large, I would say the size of like a grapefruit. And he was getting extensive rehab, trying to get him back up, and we were doing the wound care on him. Initially, it got a little bit worse, and with time, he wanted to heal. He was on a feeding tube at that time, couldn't even swallow, but we changed his feeding, sources. We gave him additional rehab therapies, and he was being seen for his wounds on a regular basis, cleaning it out. And he stood out. He stood out, and he eventually all of his wounds healed. He had a sacrococcyx wound, which is the very common wound on the bottom when these patients are immobile. He finally did better, and he was and he reached out to me down the line and said, "Hey, I'm finally healed," and he's
That's
back.
got to be very rewarding.
Very rewarding, yeah. Every so often he gives me a call now. I'm like, well, okay.
That's nice.
Yeah.
Send you a Christmas card, maybe. So as you were growing and more of these facilities were contacting you to do for them what you'd been doing, for a lot of other nursing homes,
Yeah.
obviously you, Payam, can't be everywhere all at once. So you had to start hiring people and
Correct.
training them in the way that you do things. The folks that you're training, are they other doctors? Are they licensed nurses? Like what level of
They're a little bit of everything, a little bit of physician, surgeon, nurse practitioner, physician assistant. So we're about 40 total now as a group of 40 NP, PAs, physicians who go across the country and seeing these residents. And there's a whole team that trains them. There's a whole, there's teams of nurses that train them on how do you measure a wound, how do you document it, how do you treat it, what ointment do you apply. And once they're ready, we give them an exam to take, then make sure they're ready. And then also we have another team of nurses that once they do start seeing patients, they start reviewing all of their notes to make sure all of their notes are perfected as well. So quite a bit of training is going in it, and then ongoing training as well. You're documenting this, but you're applying this cream. What is your reasoning behind it? So all of this is in there as well, to make sure we're, since it's fairly big, we want to make sure all of the providers are on top of it.
So you said they travel around, so it's not like when you've got clients in Alaska, you don't have a team there in Alaska. You have folks that
So
are
it's
moving.
all mobile. So the facilities in Alaska, there's one provider who lives in Alaska, and he sees those patients who are in Alaska. But when he uploads his notes, those notes are all remote, and then we audit them remotely to make sure that what he's documenting is correct and accurate and whatnot. So he uploads his notes, and then we, the team of nurses review those notes.
Okay.
And then there's one group of provider in Louisiana, another one in Florida or whatnot, and everybody just uploads their note to the hub, and then everybody then they review it, and then they email them and say, hey, you documented this, but maybe it should have been this and whatnot.
Gotcha. Okay. So you mentioned Dr. Strauss before, who was a bit of a mentor to you. What practical insights or techniques did you learn from him, and how have they shaped the way that you do wound care?
So he was a little bit older, and he was, he liked the old school stuff. There's so many new products that come out, but he liked the old school stuff, and that's what I was taught from. These are the old school stuff, and the nursing homes like these old school stuff as well. So, he showed me how to do a debridement, which is cleaning the wound. You take a little small surgical knife, it's a disposable knife, and you cut out the dead tissue. If you leave the dead tissue in there, it's, a high risk for, not healing, possibly getting infected. but the wound will not close and heal over a dead tissue. So the dead tissue has to be removed, and that's done through debridement and different creams that we apply to get rid of the dead tissue and keep the blood flow there.
You apply a cream to get rid of the dead tissue instead of like physically
Oh,
cutting it out.
you do both. So you first, cut it out, and then of course you can't cut everything out. It's kind of hard. It could be painful for the patient, even though we apply numbing, sprays and injections, but you can't get rid of all of it. And it can be, the patient can be bleeding a lot and whatnot. So therefore, at the end, we also apply a cream that will remove some of the dead tissue if the dead tissue remains. So he kind of taught me how to do all that, how to clean the wound, how to debride the wound, which ointments go on what, and it worked, how to flush a wound out. Sometimes people are just cleaning the surface of the wound, but sometimes the wound is deep. So how to irrigate them and all this sorts of stuff.
And you mentioned that there's a lot of new products that have come out. Are they mostly just like other ointments that have different substances in them that sort of affect the healing in a different way?
There's all sorts of stuff, ointments, patches, cleansers, you name it. They have new products that come out every day that, and a lot of it's the same stuff, just rebranded differently, to be honest.
Mm. Is there something that you want to see come out that doesn't exist yet?
I don't think there's any, magical cream or ointment. A lot of it's, getting rid of the inciting agent, what caused the problem first, get rid of that problem. And then just making sure the moisture, it's not too dry and it's not too wet to cause maceration. I think these are the two main, and keeping the wound clean, keeping the wound clean and making sure it's not too dry or too wet.
Doctor, what advice would you have for folks listening that are interested in advancing their own career in this field?
Work hard, show up, and don't, work hard, show up, be there on time, be punctual, don't show up late. And, give it a chance. I think marketing is important. You have to have a good marketing team as well. Otherwise, nobody's going to hear about you. Word of mouth, goes far, but it doesn't go, you can't become nationwide with word of mouth. And work hard and do what's right. Don't always go after and chase the money. If you do what's right, if there's a need for something and you can sell it, go after it and don't just always look at the money.
Do you feel like that's been the biggest key to your growth and your success, or are there other sort of creative levers that you've pulled that have allowed you to grow the way that you have?
Some people help me a lot, make systems for me that run well. Computer systems for marketing, that has done quite well. I have online courses for nurses to renew their license. We offer these, to a lot of the facilities and also the general population for all healthcare professionals to take these courses. But you got to get your name out there. And, be responsive to them.
What does your marketing look like? You're talking about the courses, and that's probably great. It's probably another kind of revenue generator, but it's also a way to kind of build your name and your brand.
Correct.
What do the ads look like that you're running? Is this like Facebook, LinkedIn kind of stuff?
All of them, Facebook, Google, run it for the course, run it for the services, and you just have to keep running it, some months you see nothing, but some months, the course does pretty well.
Yeah.
The course is at an all-time high this month. So,
why do you think that is? Here we are, very end of January 2025. What's
time? The word gets out there, and you have to price it fairly, competitively compared to others. You have to give them what they need. If they need X amount of hours to renew their license, I try to give them what fulfill all their hours, give them exactly what they need, and market it fairly.
How would somebody find your course?
I think I'm on like the number 1 or 2 spot. So if you check for wound care certification or wound care courses, I come up on Google as like the number 1.
Okay.
Yeah. And
would they also find it on your main website, snfwoundcare.com?
Correct. They could find it on snfwoundcare.com or on Google. We come up, pretty immediately.
Right. And we'll include those links in the show notes for folks.
Thank you.
So let's see. A book, course, or a podcast, something like that that's been particularly helpful for you that you might recommend to somebody else?
Honestly, a lot of my stuff has been trial and error on my own. finding, a problem and looking, finding for a solution to get it going. A lot of these, like needing supplies from places. So I would ask people, where can I go to get this? And I ended up on Alibaba finding something, ordering it, and now pretty much all of my stuff is ordered, via that. But honestly, you have a problem and you figure out a way to solve it yourself is what I've come across.
Yeah. Let's see, where do we want to go here? Everything is sort of self-taught. Is there a particular philosophy that guides you in your daily work and your business?
Yeah. Be available and do what's right, honestly, is the philosophy that has worked. That is our main goal is, care for these residents. Don't look what it's going to bring in value wise, just see the patient and take care of them. And eventually, everything falls into place. We get called out to go do things, 30, 40 miles away and the patient has no insurance. We still go, and then
And that in advance, going there, they've got no insurance.
It happens all the time where I just tell the office, just have somebody take care of it. It doesn't matter. So I know in advance we're not going to get paid, but it is what it is. Somebody gets sent out and I still have to pay the providers going out there. They're not going to do it for free, but they still go out there, take care of it. And, but you look at the big picture, it's very profitable what we're doing. So you eat some costs.
I wonder where this comes from. You mentioned sort of, early your parents coming to this country from Iran and that, experience of going to the doctor and saying, hey, we're not going to see you because you don't have good insurance. Is there more to sort of this? Because, I agree with you and I love what you're doing. Just sort of do the right thing and everything else takes care of itself. But not everybody's wired that way. Yeah. Is that something that was taught to you from a very early age? Were there any other formative experiences that sort of shaped that in you?
I've had quite a few mentors. One of my other, when I was in residency, there was another gentleman, Dr. Alan Scott Ragland. He was the same way. He would just say, don't look at the money. You don't look at it that way. Just do what's right for the patient. And that, I remember when we were walking down the hallway and he had his cup of coffee in his hand and he would always slam it down and say, do what's right. And these things just stick with you, and we're in this field to help. And honestly, there are some physicians out there who, I don't think they're always doing the best and whatnot, but if you are actually out there caring, people will notice it. People will tell that, you're not going to get anything out of this, but you're still doing it. And they will call you out and say, hey, like this guy goes and does these things regardless. He won't even ask what the patient's insurance is. He'll go and he'll take care of it. And you're likely to use him.
It signals that you're a good human being, and that's who we want to work with.
Yeah.
So as you've grown, Payam, I'm wondering how much time you actually get to still practice and see patients versus, kind of running this business.
I don't see patients anymore unless something urgent comes up or it's like please go and see my loved one. I'll go and take a look. But it's just all administrative work now. But I have a lot of time to myself. It's quite nice. As long as I have my phone on me, I pretty much, get to go to the gym at 10 a.m. and enjoy life. And, I walk around. People think I don't have a job, but as long as I'm nice. On my phone.
Do you miss any of that direct patient contact, or like it's, I assume it's got to be pretty stressful, especially to see people in, conditions that aren't always great.
I do miss it. It's nice, but I like what I do better. I do, waking up at 4 a.m, going into work, seeing these patients was nice, but it was tolling. It's not easy, be up and then go to bed at 7 to wake up at 3, 4. But I do miss it, but I love what I do now. Running a company, it's very stressful in what I do currently. Since we have so many facilities, I always get called with complaints. Nobody calls to say how wonderful we are. But even though, you get 3 or 4 complaints a day, which is pretty good when you have, 300 facilities, or you get 3 or 4 complaints, it's not bad.
Yeah. That's a pretty good ratio,
Yeah,
especially when it comes to medical care, because there's all kinds of things that are outside your control.
and honestly, a lot of it's like their problem because they procrastinate or they don't do things well, and then they're calling me asking me like how I can help, and I'm like, I don't even know how to get out of this one. But we try to always figure it out.
What's it like there in the nursing homes for the patients themselves?
I always thought about this. I think it's, a lot of these patients, I go in the morning when I was going, so maybe that's why I don't, a lot of these patients, nobody comes and visits them. There's not a lot of family, or their family's out of the state. They're alone in there. Some of these nursing homes unfortunately have a turnover that can be higher than normal. So then if they're using an agency to staff, it could be a problem. They don't care as much, but some of the nursing homes are amazing that are well run, and some of them you see like the high turnover, the staff don't care, and then the patients suffer. But it is what it is. This is what happened. Getting old is not it's very tough.
Yeah,
it's very tough, and we're all we're headed that way.
You talk about a lot of these nursing homes that have a fair bit of employee turnover. How do you approach your team building, recruiting, retaining good folks? What's your approach there?
I give them a lot of, they're their own boss. They go out there, they see these patients. I don't micromanage any of them. They do their own thing. They get paid pretty well. And do we have a high turnover? The only time I see turnover is when the provider is going to like one building and they're like not happy just servicing one facility. They want like a full-time gig. So that's when we'll see I have high turnover in these facilities, is when I can't give them enough work. But usually the people that we are servicing more than 3 or 4 facilities don't leave us. They stay with us for quite a while.
Mm. Doctor, growth often comes from some of the biggest challenges that we face in our lives. I'd be curious to hear about a serious challenge that you've had to overcome, whether it's personal or professional or maybe both, what that was like, how you got through it, and some lessons that you learned.
Yeah, so I would say being my competitors coming after me when I first started out. Honestly, I was seeing 2 or 3 patients, and I get a cease and desist letter from a competitor telling me, to pull, back off. And I was just so confused, and at that time I didn't have, I was a tiny little, I wasn't even a company then. It was just me solo trying to see patients, and getting a cease and desist letter from a, decent sized company was kind of scary, like, how am I going to pay for this? What am I going to do? And I remember their attorney calling me, and I'm like, what do you even want? But you just know that what you're doing is you're not doing anything wrong. So they can, and I pretty much told their attorney, I didn't even have my own attorney. I'm just like, no, I'm not doing anything wrong. You can do whatever you want. Send me as many letters.
What were they trying to say that you were doing wrong?
Trying to push me out, trying to monopolize the, do whatever kind of work they do, good or bad, and then just don't let anybody else in the field, right? Because if you get into the same business and you do more than them, you do better services than them, then you're going to get more of the clients, and then they're going to be pushed out. So the less competition that, they have, the better it is. So they're just trying to push people out. So I just stood my ground, and then they kept coming after me for other stuff and other bogus, and you just stand your ground. And then the latest one was another, lawsuit. But this time I got my own attorney and we won the case. So, but they keep coming, competitors I've never sued anybody in my life, but competitors come after me, but I stand my ground at this point. I don't back off because I know what I'm doing is not wrong.
What are they trying to say?
Pretty much just push you out. Trying to say you're taking over these contracts for, the latest one is like my phone number, like, get rid of your phone number. I'm like, I've had this phone number for 7 years.
Something illegal about the sequence of digits in your phone number?
My phone number is 833 Dr. Wound, DR Wound. So remove Dr. Wound from your number. My license plate says Dr. Wound on it. So they call me to tell me to remove these things because they're using it in a different state. And I'm like, oh man,
Wow.
I'm like, I don't even know how this even affects your business, but I have my own trademark attorney, and I just send him a letter. I forward to him, and he sends the guy a letter within a day, and we're waiting to hear what the results are. But I try not to back down anymore, and just as long as I'm doing what's right, we go forward. We push strong. If you keep,
Clearly people are threatened by you.
yeah, they're threatened by me, but get your act together and provide more services.
Level up your game. Yeah, that's the way to compete, not with these goofy lawsuits.
Correct. Provide more services.
Yeah.
Don't complain, and don't complain when they call you at 2 a.m. Take care of the job. They won't switch out.
So what do growth plans look like for SNF Wound Care? Is this more territories, more services?
Territories. Yeah, I don't know if I could do more services. I pretty much do all of them that you can ever imagine, but more territories. A lot of these nursing homes are very scared to switch. They're like, oh, we're going to switch to you. We're scared and whatnot. And I'm just like, you have to try new things. So, I'm like, even in our agreement, when we sign them up, it says you can cancel same day. You don't even need to give us a 1-day notice. If you don't like us, we leave. We're not coming back. So just to make sure they're not threatened that like we're going to want to come there and stay around. Like, you don't like our services, we leave the next same day. So, but yeah, look to expand, get more territories, get the name out there. And, I have a great team in the back that runs all of these, facilities. We have a great team, and, so just.
I love what you guys do with the contract there. Now, obviously there's some businesses where, the service provider has got a lot of upfront fixed costs. And so they want to be able to make sure that, they can recoup that over time. And so I understand the, kind of the purpose and the value of having contracts with terms in them. But yeah, and a service like yours, like what you're doing is providing people with the ultimate level of comfort, saying that I'm so confident in what we do and the way that we do it, and that you'll be happy with it, that, right in the middle of the service, if you don't like it, you can tell me to leave, and that's it. There's no, I think that's great.
Some of these facilities, some of these other companies have like a 90-day, 6-month termination notice. I'm like, you could sign the contract now and cancel it in 10 minutes and tell me you don't want me to come back. But yeah, so I don't want, if they're unhappy, I don't want to go there. We don't want to go there, right? We want you to be happy with our services.
Oh. So. Payam, any daily practices that kind of help you through your day and make sure that you're ready for everything?
Yeah, wake up early in the morning, go to the gym, and I think that's a nice way to de-stress. Get to the gym every day and get my cup of coffee and pretty much get the day going.
So early, did you hit the gym this morning before our interview?
I'm waiting to get, after this, I'll be heading to this. It's still pretty early here.
Yeah, I was going to say, that means you're a pretty early riser.
Yeah, and go to the gym and just enjoy the day. You go to lunch, but, always be ready, because you never know, right? Somebody might call out sick and I have to go somewhere, fly out somewhere. So, be ready to go.
No. Sometimes, in my experience, our mistakes end up becoming our greatest teachers. Is there an early career moment that seemed like a setback to you at the time that actually helped to propel you forward, looking back now?
Yeah, there was actually a malpractice lawsuit that was very unfortunate, but pretty bogus. That happened, while I was in, right when I got out of training. And even though I had nothing to do with the case, they sued everybody in that case. And it kind of, I'm like, I don't want to be doing this hospital work forever. This is high risk stuff, even though I had zero involvement, zero exposure, they still sue you and they still, try to go after you. So that was like a turning moment. And I learned a lot about the legal aspects of things, of, how these, malpractice lawsuits work, how to document appropriately, and how to save yourself. Otherwise, that would have been it was a disaster. I mean, it was a disaster case that happened. But, even though you have no involvement, no exposure, they still come after you, and you learn the whole legal system of these malpractice cases. And at that point, I'm like, I want to get out of this, hospital work. It can be very problematic.
Which is terrible, right? Because we need more doctors and medical professionals. We don't need to be scaring them off with these kinds of things.
They scare you off, correct. It's so wrong, but they scare you off, and it's all about, them, making a buck. But yeah, they scare you off.
What's a specific thing that you learned about how to protect yourself and be sort of proactive?
Oh, just document appropriately. Document, what you saw, who you spoke with, um, your treatment plan. And, the hospital is very helpful with these things. The hospital has so many different layers of protection that help protect physicians as well. But when a case goes wrong, you have 10,000 cases, all of them go well, one goes wrong, you know, it bites you, it bites you in the butt. And there's multiple, and when you have, when a patient's hospitalized, there's not just one physician. There's usually 10, this is an ICU case patient. There was about, 15 physicians on the case. And everybody got sued, from the residents to the ICU to the ER doctor to everybody. So we pretty much learned from that case of what can go wrong.
Mm.
And
Put the legal stuff aside, and obviously, like we were sort of touching on this before, in medical care, things are going to go wrong. Not everything is within your control. You are not a god. Like, you can't heal everybody. And so when you are, again, legal stuff aside, just on the personal side, like, how does it affect you? How do you work through when there's an outcome that's less than favorable?
I'm in a lot of these physician group chats on Facebook and whatnot, and I mean, you can't sleep for many, many nights. You can't sleep. You're worried, and you tried your best, or something went wrong, and it was out of your control. But night sweats, you don't sleep well. You're worried. You're bothered. You don't go out. You become depressed. It was pretty bad. I'm like 1 month out. 1 month out of my residency, and I'm getting sued. Am I going to lose my license for this? But luckily, absolutely nothing happened. But I can see, other physicians going through the same thing, and they might have other issues going on at the same time. It's very haunting. But the medical
Is
board
it
is very,
helpful to be able to talk with other physicians and sort of
yeah.
have a little support group there?
When you talk to other physicians, they'll tell you they've had the same thing happen to them, and there's a light at the end of the tunnel. Just wait it through. The medical board is fair. They look at the case, they review it, and they understand. And it's happened so many times before. So, and they understand. We're trying to do our best, and things go wrong. Or a lot of, I would say, most of the cases of these medical malpractice lawsuits tend to be frivolous. They just send out letters trying to see what they can do.
Mm. What's the best decision you ever made for your business, doctor?
The best decision, honestly. So one was leaving the hospital and starting my own business. That was the best, decision. And from there, honestly, it was just, I had a big vision when I started. Like, when I went to go pick my mailbox, I didn't get a small mailbox to be like, oh, I'm going to get 10 pieces of mail. I got the largest mailbox at the post office. Literally, it was like one of those massive ones. And now that mailbox gets full to the brim every few days. So I had this vision where, like, I'm going to grow nationwide from the day I started. It wasn't, I'm going to go little in something and just service some there. I had this vision that I'm going to be huge like my competitors. And I got the biggest mailboxes. I got everything like nationwide stuff. So I don't just market locally. And it grew into that. It grew into that. So I had these big visions of what I wanted to be.
Nice.
And then people would look at me like, what are you doing with this big mailbox with 4 pieces of mail? And I'm just like, it'll come. Yeah.
You had faith in yourself.
I knew I can't go wrong. I knew this is only like room for growth and expansion.
I'm the son of an immigrant. My father came to this country when he was young with his parents and his brothers. And, it was very challenging for them to make that move. They didn't know the language. They had to learn the culture, find jobs. Lots of challenges there that I think built a sturdiness and a robustness in them that propelled them to be, very successful in what they were doing. I'm curious if you think that there's some of that going on in you as well.
To be honest, I don't know how my dad and mom moved from Iran, not knowing, more than a couple words to America with 3 kids and raising us. It's like, us moving to another country like to China, like I have nobody, I'm alone. I'm single. I could do it maybe for myself as it being difficult, but I can't imagine how my dad did it with my mom, no English, with 3 kids, moving to another country and starting a family. You know, it's kind of mind-boggling. I don't think I would be able to do it, but they did it, and I saw their struggles. I saw my parents' struggles, and we didn't have anything. We were very simple and barely making it day by day, going to public school, and but I had great parents. They were all people, loving, caring, and you get that love, from them. You learn from them. You see how hardworking they are, and you become the same. I see my dad
Yeah.
is still. My dad is 84, and he's still hardworking, more hardworking than me.
Well, the apple doesn't fall far from the tree there.
Yeah.
So innovation requires courage, right?
Yeah.
Tell us about a time that you tried something completely different in your business, whether it worked or it didn't. What did you learn from that?
So what have I tried differently? Honestly, the marketing, it was totally different. Like out of my, I just listened to some person. They said, "Hey, let's try to put you on these, email and stuff and platforms." And I had no idea what I'm signing up for. But this person just, I paid her, and she pretty much just did everything. And then after a while, I realized what she had made, only to realize like that is the reason why it grew to as much as it did, is, became so big outside of the local areas because of this platform that she made. And I'm very thankful for her, but I didn't want to do it initially because I'm like, it's going to be like, what are you even making me? And it was this whole marketing platform that's amazing, and we use it pretty much all day, every day now.
What was it that she said that convinced you?
Well, she's just like, you need a way to reach out to people. You can't go to every nursing home yourself. You need a way to reach out to people, and you got to do it through either phone calls or emails or something. And I'm like, yeah, she's right, but I didn't understand the nature of what she's going to build me. And she built me like this beast program where people get nonstop, notifications, from us. And even though you don't sign up now, you've seen my logo, you've seen my picture, you've seen my name. So you're going to remember, if you need a wound care doctor, that phone number is going to stick out, that, something's going to stick out, and you'll reach out to us.
Give us the phone number again.
833 Dr. Wound.
I like it.
Yeah.
Just one more question for you, Payam. But before I ask it, I want to do a couple of things. First of all, for those listening today, I know that you love today's content. Dr. Tehrani has been a wonderful guest, sharing all kinds of interesting stories. Make sure that you don't miss out on future content like this. Hit the like, share, subscribe, follow button on your favorite podcast app. I also want to let people know the best way to follow you or to get in touch with you, Payam. What would that be?
Just on our Instagram page, follow us on snfwoundcare.com. And I'd be happy to, get back to you guys, or email us, info@snfwoundcare.com, info@snfwoundcare.com. Honestly, there's even a lot of people who send me a picture of their foot or their back or their wound, and, somebody replies to them and helps them out. Regardless. Yeah. So.
What does SNF stand for?
Skilled Nursing Facility. So it's like in skilled nursing facilities where we work at. These are called nursing homes, skilled nursing facilities. So it's SNF Wound Care.
Gotcha. So last question, as we look to the future, Doctor, whether thinking specifically about your business or the larger industry in general, what are some of the changes that you're most excited about?
What are the changes I'm most excited about? Well, I'm looking to expand, honestly. I don't know if there's any changes that are coming about based on, what we provide. Those pretty much are stable, but I'm just looking to grow, get out there, and yeah.
Are there any parts of the country where you would not operate, or is it pretty much
everywhere? I mean, we just
everywhere.
Alaska.
Right.
So yeah, Alaska, Maine, pretty much anywhere. I mean, because these patients are everywhere, right?
Yeah. And is there, what's the chicken or egg? Like, I would guess like you're looking for the facility first,
Correct.
And then once you've got an agreement or a pending agreement, you know it's going to happen. Then you go and you try to build a team there.
Correct. Yeah. So first is the facility. Once you get the facility, then you can figure out how to get things started out there.
Yeah. And does that generally involve sending one of your established people there to kind of do some recruiting in person, or you just look to hire somebody brand new in the area to kind of be your coordinator?
It really varies. We usually send somebody out there to meet with them, tell them the services that we offer after that. And if they're agreeable, then we get somebody out there to service them.
Gotcha. Well, Payam, I want to be the first one to thank you for sharing both your time and your story with us today. I really appreciate it.
Thank you for having me. I appreciate it.
Folks, that's a wrap on another episode of the Inspired Stories podcast. Thanks for learning with us today.
Thank you.